Good afternoon, grade 7s. How are you? Welcome, welcome, everyone. I can see fewer people today. What's wrong? Only 3 people. Where are the others? How are you, Molly? Hello, everyone. Let's just greet each other. Say hi to everyone. Everyone, say hi to everyone. Hi, Bright. How are you? Let's just greet each other. Say hi to everyone. Hello, hello, hello. Is everyone okay? Wherever you are. I'm fine, if you are fine, guys. Kanye, how are you? Angelina, hello. Okay, oh, that's good. I can see people now coming in. That's good. How was your day so far, grade 7s? How was your day so far? It was nice. Oh, that's good. That's from Kanye. She's saying it was nice. It was all right from Molly. Okay. As long as you are safe, that's good. All right. So let's get into our lesson. We're still continuing with world population growth. Okay. So what did we do yesterday? We looked at the factors affecting birth and death rates. We looked at the conflict and wars, and also the government policy. And then we looked at world population growth, the world population growth patterns, and also the developments affecting population growth. So that's what we did yesterday for those who were here. Okay. Did you do the homework, grade 7s? Homework? Or from Kanye? Yes, from Molly. Do you have your answers with you now? Do you have your answers? Are you sure? Can we revise together? I hope I won't be disappointed today. Okay. All right. Let's revise the homework. So what were you supposed to be doing to interpret a line graph? Did you manage? Was it difficult or easy for you in answering the questions? Did you manage to answer the questions? Was it hard or it was easy? Both. You had to think deeply. Okay, Kanye, I understand. All right. So, grade 7s, do you prefer typing or you want to say something? You can talk. Say your answers. What do you prefer? You want to type your answers? Kwapile is saying typing. Kanye typing. Molly typing because you're shy. Okay, I understand. What if you were in class? Molly, what are you going to do? How do you participate in class? In a real classroom, a physical classroom. Don't you talk to your teacher? Yes, can you answer and raise your hand? It's still the same thing, only that you are doing it online. You can say your answer. I will not be shy because everyone is my friend. Oh, Molly, okay, I understand. Okay, so let's proceed. Let's revise. So you're supposed to use that line graph to answer the questions, okay? Number one, explain why the world's population grew so slow between 1 CE and 1650. Why did the population grow slowly between that time? What do you think? Can I have your answers for question one? Explain why the world's population grows so slowly between 1 CE and 1650. Did you answer question one, grade 7? Or you're typing? Grade 7? I don't see any answers coming in. Are you typing? From Kanye, maybe the Black Death was still on. It's a way so people hate about it and decided not to have children. That's what I think. Oh, that's very good, Kanye. Correct answer. Because not a lot of babies were born. Okay, from Angelina, good answer also. Thank you for your answers for question one. And then question two, identify what happened between 1400 and 1500 to cause a slight decline in population growth. A lack of childbirth from Klami, okay. From Huapili, because people are very poor and they would be so desperate to buy medicines and to go to the hospital, and a lot of babies were born. Not a lot of babies were born, fewer babies were born, okay. Huapili. It's Amu, okay, Amu. And then we go to question two. What did you write? I guess I'll give you time to type, okay? Do I have answers for question two? Yes, we're doing question two, Kanye. Population growth was caused by Black Death. Thank you, Kwapili. And then question three, I'll just see your answers as they come in. What was the population growth between 1650 and 1850? 1650 and 1850. So you subtract what? 470 million from 1.1 billion. That is how you get your answer, okay? And then 3A, how many years did this take? How many years are there between 1650 and 1850? $200 Mies. Thank you. Welcome, Mies. 200 years, yes. And then B, how many years did it take for the world's population to grow from 300 million to 1.1 billion? So it's from 1 CE to 1850. How many years are there? Do you have your answers with you, grade 7s? Did you write something down? Isn't you supposed to give me your answers? Did you write your answers down? Give me your answers then. Remember, we're just going through what you wrote. We're revising. So you should have something written down. Well, on question B. I don't see any answers coming in. Did you try to do C? Explain what happened between the late 1700s and 1850 to cause this rapid population increase. Let's see from the line graph from 1700 to 1850. That is after the Black Death. What do you think happened? Isn't it? There was no pandemic anymore, so more babies were being born. So this led to what? To population growth. Okay. Also, the same answer for D. Explain why the population increased between 1650 and 1850. It's because of things like Industrial Revolution. Yes, Kanye, it was after the Black Death. That's good. So I was saying things like Industrial Revolution led to what? Population growth. The answer for D. And also, there was no Black Death anymore. And then E, what pattern can you see in the rate of population increase from 1850 to the present? What is happening? Let's see from 1850 to the current time. Can you see that the population is increasing from 1850? To 24, sorry, to 2012 up there. Can you see that the population is increasing? Okay, so that's the pattern. That's what they mean by the pattern, okay. All right. For those who try to do their homework, thank you. you tried your best, okay, to the lesson. From Kanye, because there was no disease, because it was after Black Death, so people had more kids, there was high BR. Thank you, Kanye. Very good. Okay, now we get into the lesson. I want you to listen, okay? All right, grade 7. So you stop private chats unless I ask a question, okay? Then you type your answers. I want you to focus. But now during the COVID-19, there will be lower BR because people won't have many kids. Yes, that's correct, Kanye. All right, so let's get into the lesson. So for today, we're still looking at the world population growth. We're going to look at scientific developments, improved sanitation, canned food, and refrigeration. And then lastly, we're going to look at the improved healthcare. Okay, so that is what we're going to look at today. Remember, we're still talking about the population growth around the world. Okay. Now let's start by looking at scientific developments. Okay. Some scientific developments have affected world population growth. What do you mean by these scientific developments? Anything related to science, okay. We're going to look at control of disease and infections. Remember, in history, for example, in the 13th century, there were no scientific developments back then. So it is different to the times that we're living in now, okay? Because new equipment is being invented, new machinery, new vaccinations, new medicines. That's what we mean by scientific developments. Various infectious diseases have decreased the population around the world. Now, can you see like the pandemic of COVID-19? Diseases like HIV and AIDS, malaria, all of those diseases, they affect what? Population growth. The population decreases because many people are dying. A proper control of these diseases was needed. So scientists were worried about these diseases. So they had to come up with a plan, those scientists, in order to control these diseases. But how were they going to do it? Therefore, vaccinations were invented to decrease death rate. Do you know that when you're a baby, you receive a vaccination? You get a vaccination at the clinic. So your mom will take you to the clinic when you're a small baby, you get vaccinations, an injection, a medicine, so that you are protected from what? From different diseases, okay? For example, vaccinations for measles, hepatitis, meningitis, and polio, okay? All right. Sfiso is asking, what is a vaccination? Let's help Sfiso. Does anyone know what is vaccination? He doesn't know what is vaccination. Does anyone wants to try to help Sfiso? Okay, I can see the hand for Huapili. Yes, Huapili. You can say something.
Vaccinating is a treatment for cure.
Oh,
Or when you want to get vaccination is used when for sickness and when some people are are in treatment.
Oh, okay. Thank you, Wapile. Okay. Also from Shami, he's saying it's a treatment or cure. It's a treatment. What does it mean? Sfiso, they're explaining to you. Can you see the answer now? Sfiso, it's a treatment that is given to you so that you don't get diseases. Okay, Sfiso, it's called a vaccination. So normally you get your vaccinations when you are still a baby. All of the people around the world, your mummies, they take you to what? To the clinic. Okay, and then you get different injections and medicine so that you are protected against different diseases like polio, measles. Okay, up to 12 years. Yes, that's correct, Pride. Up to 12 years. Vaccines are a fluid that helps your body to become immune to diseases. So your immune system gets stronger. Well done, Kanye. I hope so you're reading, eh? The answer from Kanye. Okay. So that is a vaccination. It helps a lot. Without vaccinations, more babies are going to die. Okay. So the scientists, they started developing what? These vaccinations to help to control diseases. Okay. Antibiotics were also developed to cure people from many illnesses. Also, there's what is called sterilization. Do you know what is sterilization? Does anyone know? What is sterilization? Or to sterilize something? Does anyone know what is sterilization? You don't know. Grade 7, does anyone know what is sterilization? So, okay, sterilization is, these are certain measures that are used in healthcare facilities, like in the clinic. Have you ever seen when you go to the clinic or to the hospital, the way they clean the equipment that they use? So they clean those equipment. It's called to sterilize, okay? It's sterilization. They don't want the diseases to spread around in the clinic. Yes, it's also sanitized. Okay, so they want to limit the spread of diseases. So all of these things, we are saying vaccinations, antibiotics, and the sterilization measures were developed by scientists to help control diseases and infections. Okay, class 7. Always remember that. Vaccinations, antibiotics, sterilization, those were invented by scientists to control diseases. Yes, because there was high DR. Thank you, Kanye. Because the death rate was high, so scientists had to make a plan to save people. Oh, Angelina, I'm sorry. You were supposed to get a vaccination. Okay. Don't worry, you get one. And then we look at improved sanitation. What do we mean by sanitation? What do we mean by sanitation? Is there anyone who wants to try? Proper hygiene and protection from bad germs or diseases. Oh, that's good, Kanye. So we are saying when there is improved sanitation, DR decreases the death rate. Okay. When proper sanitation practices were developed, this led to a decrease in diseases around the world. Diseases like cholera are a result of poor sanitation. And this increases what? Death rates. Public health revolution began around 1855 when there were improvements in sanitary and social conditions. Clean water, proper sewage systems, regular garbage collection have helped to decrease spread of diseases. So these three things, perseverance: clean water, proper sewage systems, regular garbage collection, these are part of sanitation. Okay. We want to see clean water being provided to people. We want to see the proper sewage systems. And we want to see the refusal or the garbage being collected so that there is no litter everywhere. Okay. Therefore, public health revolution led to an increase in life expectancy and population growth rate. So we're saying this revolution, they were concerned about what? The health of people when it began. So they started to notice that people are getting sick because of lack of sanitation. So they were worried about that. That's when this revolution came in. They were more concerned about the health of people. Okay. So this revolution, it increased what? Life expectancy and population growth rate. This in turn prevented the spread of diseases like typhoid and cholera. Okay. So we're talking about improved sanitation. Okay, let's move on. And then we look at canned food and refrigeration. Why are we learning about this? Is it really important? Of course it is important. The canned food, you know canned food or tinned food that you eat at home, like the tinned fish, tinned beef, and so forth. And also refrigeration, when you put your food in the fridge, okay, it's refrigeration. So why is it important that we're learning about this now? Okay, population growth is affected by availability of adequate food. So when there is more food, people, they live longer and the population growth increases. But how do we take care of our food? How do we preserve our food so that we have more variety of foods around? The inventions of different methods to preserve food, for example, canned foods and refrigeration, meant that there would be surplus food for people. So back then, when different inventions were being made, they realized that if you can food, if you put foods in a tin or a can, you help to preserve that food for longer. Also, they started to make what? Fridges, the refrigerators, so that food can be preserved for longer. Canning foods meant that greater quantities of food could be preserved, which resulted in improved health, life expectancy, and a decrease in death rate. To understand grade 7s, what we're talking about, canning foods. Can you see the advantage of canning foods? Why it was invented? Yes, Kanye, what would happen if there were no fridges? They are so reliable and important. Very good, Kanye. Very good answer. Imagine if we didn't have fridges. Our food would rot. Refrigeration also helped in preservation of foods. As more food could be kept fresh for longer, this meant that healthier diets for people. Yes, meat would rot, Boipilo, that's correct. Okay. Therefore, life expectancy increases and death rate decreases when people have healthier foods that are fresh. So imagine in your fridge, you've got fresh fruits, vegetables, you have your meat there in the fridge. And when you eat fresh foods, what happens to your health? So you'll be healthy, you understand? Because you're eating what? Fresh foods. Okay. All right, so that is the benefit of canned foods and refrigeration. All right. So they also affect what? Population growth, these two. We're talking about preservation of food. It's also important. Yes, it improves. Your health improves. Okay.
Yeah, very nice. Let's go get more people. I'm sure we get hot as well. Oh, bro, that's an easy.
Wow, who is putting their audio on? Stop that, please. Okay, and then we go to improved healthcare. Improved healthcare. What are we talking about? Since the inventions of equipment, healthcare has also improved. So remember, new inventions are just keeping coming. Every time people are inventing something. Okay, so when this equipment was being invented, healthcare also improved. This means that provision of public healthcare can increase life expectancy and population growth rate. Remember, I was saying, if people are getting the right treatment, the healthcare services, they can live longer. Okay. Examples include the invention of X-rays. It was a good thing when they invented X-ray. They are able to see the inside of your body. Understanding of germs. Many scientists, they were able to understand how germs operate and how this leads to people get sick. Okay. Yes, so that they can see what's happening inside the body. Thank you, Kanye. And also advanced equipment used during operations. You know, there are different operations that happen every day to some people who are not feeling well. And we thank those people who invented those machines, those equipment, so that operations can be done successfully. Imagine if there was no that type of equipment. What was going to happen? People would die. So we're saying inventions are a good thing. Okay. Improved healthcare increases life expectancy and decreases what? Death rate. Therefore, the government is trying to improve public health care to ensure that there is productive population. So all countries around the world, they have a vision. They want to see their people being healthy. They want to provide proper healthcare services. That is their main mission for all the governments around the world, of which it is a good thing because people will live longer, less babies will die, which is good. Okay, so we are saying we want to see improved healthcare because it affects what? Population growth rate around the world. Ah, that is the end of our lesson. Wow. I hope you learned something. Did you learn something today? Okay, 7th. What did you learn about? Just type something for me. Summarize what you learned today. Let me see your answers. Those who are listening. What did you learn about? Okay, to store food in good places. Oh, that's good, Swiso. Others, what did you learn today? From Kanyi, I enjoyed the importance of fridges and canned foods in good health and sanitation. Ah, that's very good. Jabulo, population. What about population? From Molly, why it is important to have fridges so food does not rot. Oh, that's very good. Jabulo, try to be specific. What did you learn about population? Others, where are your answers? What did you learn today? Where is Angelina? She's quiet. Okay, so this is your homework. From Kanye, how fridges and canned foods affects population growth so people can have healthier foods to eat. Oh, that's good. Boy Pillow, scientific development has affected world population. Thank you, Boy Pillow. Very good. More answers? Are there more answers coming in? What did you learn today? So this is your homework. Take a screenshot, or if you are copying, just copy the questions down. Thank you, Molly. You're done. Thank you, Kanye. Sfiso, what did you learn today? Sfiso, what did you learn? Menes, what did you learn today? I haven't seen your answers. The importance of antibiotics. How do they help people, antibiotics? Swiso. From Angelina or from Boypilo, the importance of improved healthcare. Okay. From Angelina, I learned about the control of diseases and infections. Okay. So in all of these, what are we concerned about? The things that we're learning about. We're concerned about what? The topic that we're focusing on? Yes, Bright, you can. Feel free, Bright, if you want to say something. You can go on.
Ma'am,
Yes.
ma'am, I learned that some diseases can affect the death rate.
Okay. Oh, that's good. Thank you.
My pleasure. Your pleasure.
Thank you, Bright. From Kanye, population growth. No, Kanye, your first answer was correct. Yeah. Molly is confusing you. Population growth, yes, that's correct, Kanye. That's what we are, yes, that's what we are talking about, isn't it? We are talking about world population growth. From Boipilo, I learned polio is a disease needed for vaccination. Oh, that needs vaccination. Okay, thank you, Boipilo.
You macaca.
May you please stop playing while we are in the lesson, please, grade 7. Stop pushing those buttons. Okay. She thought it was wrong. I said natural sample and mean. Oh, okay. All right. Okay. So I saw your answers. Did you take the homework? Are we done? Okay, that's good. So if there's nothing else, it was nice having you, grade 7s. Please be safe wherever you are, okay? Stay indoors, practice social distancing, okay? And it's a Friday today. Have a nice weekend, everyone. Then I'll see you again on Monday, same time. Okay. Please take care. Take care, everyone. Have a great weekend. Okay, bye, everyone.